I am the Chief Program Officer here at Horizon Treatment Services, and it is my pleasure to share some information about our residential level of care programs and how they are positively impacting client outcomes in their recovery journey. Before I dive into some of the data that we are able to speak to, I really want to uplift the client experience and the type of presentations individuals who require residential level of care often present. And for us at Horizon, many of our clients, if not majority, come with pretty heavy clinical presentations. We're talking about trauma symptoms, really intense and severe depression and anxiety symptoms that make them very vulnerable to chronic conditions. And it's really important when we're recognizing the severity of their presentations that the services they receive are very high quality and that they are specialized. And specialization is key when we're talking about effectiveness in treatment because we want to be able to address the right problem. We do not believe in a generalist model here at Horizon, and so we want to provide effective solutions that address the exact challenge that our clients are facing. And in order to support that, we emphasize specialized trainings of our counseling staff, for our therapists, associate and licensed level therapists, our supervisors. And it's a really big part of our culture here, learning and continuously learning so that we are providing up-to-date evidence-based interventions to our clients that align with their presentation is a really big deal. And so with that said, some of the modalities that we use in our residential level of programs are focused on cognitive behavioral therapy, dialectical behavioral therapy, as well as narrative behavioral therapy. And as a result of these platforms and spaces, our clients are able to find that safe landing space to process some of their traumas and depression related symptoms, both in individual counseling with their therapist, as well as counseling sessions with their counselors on site who are available 24/7, as well as their group therapists and facilitators. And so with that said, what I can speak to is that based on the Vista research data that we're able to collect, we can show that from 30 days of treatment, our clients' symptoms significantly reduce when they are receiving consistent weekly individual sessions as well as group sessions. And so what I mean by that is if an individual, for example, is presenting, let's say, 8 out of 10 as a symptom severity for depression, we're able to show that within 30 days of treatment, that severity in that particular symptom does reduce by about a third within 30 days. And similarly, we're able to show quite effective reduction when it comes to anxiety symptoms just within 30 days of treatment. And so we do utilize the PHQ-9, which is a depression inventory scale that is reviewed and approved by the American Psychological Association, as well as the GAD questionnaires that evaluate the individual's anxiety severity. And so our process when we're utilizing these questionnaires is to consider the baseline. That's very important because in order to clearly see the impact of our treatment over time, we have to have baseline data. And so every single client does receive these questionnaires from intake, and they receive also these questionnaires weekly, and we're able to compare the severity of their symptoms as they are self-reporting, which is very important, over time. And so when we compare their weekly data to their monthly data, and as well as to the data from 2 months or 3 months out, we can see that over time, the more the individual engages with individual therapy, with MAT services that we also provide, as well as group sessions, that over time their symptom severity does decrease. And we also know that the longer the individual stays in treatment, less their symptom severity becomes. And so I also want to unpack that component because it is an important detail to highlight. Our clients, when they present to us, really require a full wraparound service. As I mentioned, therapeutic support is important, talk therapy. They receive medication management through the support of our nurse practitioners on site, as well as medical doctors. But then there's case management. Progress when we are thinking about our healing journey is not a linear path. So over time, as much as the individual is exposed to new information and is able to process some of their challenges more effectively, we also have to think about their structural needs. And so our case management there plays a big role when identifying the next level of care or the resources the individual is going to need in order to set them up for success upon their graduation from our residential programs. And so we really go out of our way to integrate case management in a timely fashion so that it's not a last minute afterthought, but the client is really a part of those discussions when they are ready, when they're really able to focus on what's next for them. And we also know that individuals who stay longer in residential level of programs have significantly lower relapse rates compared to those who have to leave prematurely or have a shorter length of stay for various reasons. And so we know that individuals who stay up to really 3 months, up to 180 days, 90 days, these individuals have significantly higher success rates when it comes to committing to more and more independent living skills, integrating back into their communities and lives, being able to focus on occupational goals and being more independent with their recovery journey compared to those who have a shorter length of stay. So much so that we can say that individuals who receive services between 90 to 120 days on the residential level of care with this specific presentation have about 5 times more success rate when it comes to staying on track with their recovery journey. And those, unfortunately, who have limited access to residential level of care, and by that I am referring to anywhere between 30 and 40 days of treatment, have a really hard time staying on track because they're simply not ready to be able to address the so many layers of their treatment that requires sensitive and person-centric attention. And that goes all the way from individual therapy sessions to medication management to support around engaging in different levels of care in the system.